In this episode, I discuss how becoming fascia-informed adds an entirely new layer to our critical thinking process when it comes to helping clients with balance issues. I will also share some research that looks at fascia and balance in both kids and adults. After I put this episode together, I realized I didn't tell the rest of the story in a case I shared. Here's what happened. A family member came in and helped her thin out her wardrobe, and she was able to remain in her independent living apartment fall-free. Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today we're going to be talking about balance, and this came up for me because I had a client who is well known to me. I haven't seen her one-on-one for quite some time, but she participates in my weekly classes, Fascia-Informed Yoga and the Fascia-Informed Fitness. And I talked about in one of the classes, I was sharing with them a little bit about the one-legged stance test article. And that was an article that came out in 2022, and it's actually titled Successful 10-Second One-Legged Stance Performance Predicts Survival in Middle-Aged and Older Adults. And it was in the British Journal of Sports Medicine. And it's been out for a while, and maybe some of you have already heard about it. And I'm sure I've talked about balance in the past, and we actually incorporated this into a program that we did for a few years, which was called the Pre-Fitness Assessment Test. And it was targeted to women, kind of middle ages and up. And we were trying to encourage them to look and see if their body was ready for exercise. So we called it a pre-fitness assessment. And this is kind of a concept where the Fascia-Informed Woman course came from as well. But anyway, I was talking about it in the yoga class because we were doing some balance. We were doing the tree pose. And I give a lot of cues in tree pose to get people to think about not just you're challenging your balance, but here's all the little details that go into building your balance. So all the different components of balance. And so then I actually walked them through how the one-legged stance test is administered. It's very, very simple. You simply stand on one leg, you let your arms drop to your side, and you wrap the back of one foot around the back side of the ankle. So the top of the foot is touching the back of the calf. And you look straight ahead, and then you count for 10 seconds. Somebody else counts for 10 seconds. And this article actually encourages that this would be a great test for physicians to do in the office because it's quick and it's easy. And this article connected the ability to pass this assessment with all-cause mortality, that your risk goes up in general in big ways if you cannot pass this assessment. And it doesn't mean that go home and work on your balance. It means dig deeper, figure out what's going on. So she sent me an email, and I'll read the email to you. During your yoga session on 1/14/25, you commented that family physicians are encouraged to screen for balance problems by asking the client to stand with one foot crossed over the other. I have not been able to do that for the last 5 years. What problems does the test indicate, and how can a person improve this situation? So what I emailed her back, and I'll read that to you as well, but then I did my whole next class on here's all the details behind balance and here's how to think about it. So when I replied to her, and I attached the study that I was referring to because she does have a healthcare background, and I said there's a picture of the stance they used in the study. One leg is actually crossed behind the other. The study does not go into how to rectify balance issues. That is very individualized, since balance issues can stem from so many areas. From what I know about your personal situation, the source of the balance seems multifactorial and the root cause is unclear. Now, I will stop here, and she's been checked out for a lot of different things, but it is a really unusual situation with her. So the way I look at balance, if that it is not vestibular, you need to look at strength and sensation. Do you have enough strength in your feet, ankles, knees, hips, and core to hold your body in place? And can you feel the minute shifts in your body and correct them spontaneously? If balance is a challenge, safety is paramount, because as OTs, big on safety, right? Preventing a fall, and can your body move quickly to catch yourself if you do lose balance? I try to include all of these things between the Tuesday and the Friday class, and do you have more questions? So I haven't heard back from her yet, but I wanted to, like I said, I was trying to educate and teach a fitness class at the same time, and it went okay, but it helped me organize my thoughts, and I thought I'll do a podcast, I'll record it on video, and then I'll try to deliver it in such a way that it's interesting for therapists, but it's also understandable by the public. So here we go. Okay, so here's how I think through balance issues as a fascia-informed therapist. And what you'll notice is that, and then I'm going to provide some research at the end too, so stay tuned. What you'll notice is that all the other things we know and think about balance are still true, but adding in that layer of fascia knowledge, the science of the fascial system, gives us more information and more potential strategies to help someone. So there's many potential causes of balance issues. And if you're experiencing lightheadedness, dizziness that causes a loss of balance, you should definitely go see your MD or your primary health care practitioner and start sorting through what's going on there. The next thing to think about, is it a neurological problem affecting balance? And if yes, can we change it, or do we need to compensate? So as OTs, we can either help the body make a change, and sometimes that change goes really slow. Healing can go really slow in the case of neurological issues. And in some cases, things may never change. So we have to compensate. Sometimes we're doing both at the same time, right? We're compensating, but we're still working on that rehabilitation aspect so we can help our clients improve. Another thing to think about is your medications. Are your medications causing the issue, and could some adjustments in your medication help the problem? And then the next might be, is it a cardiovascular issue, a blood pressure issue, orthostatic hypotension types of issues? And then other simple things like dehydration, could that be an issue? And then next, we know vision is an important component of our balance. So is there an impairment in the vision that needs to be addressed? Is there some kind of numbness or sensory dysfunction going on that of the skin, basically, that is causing us to not be able to feel. And we know, and things like people with long-term diabetes can have problems with their feet and experiences of numbness. And so there's probably maybe more things in that category. You know, we don't want to spend a ton of time going down every road there, but you get the gist. If it's a medical issue, then see your MD and make those adjustments, do what you can, and then I'm primarily going to talk about what happens after that. So if the person is otherwise healthy, what are we looking for? And I say one of the things that we need to look at is the fascial structure, the tension in the fascia, because it is our primary proprioceptive organ. It gives us most of the information that we need to feel our body in space. And so if you have tight fascia, that equals poor information getting to the brain, poor information or not enough information to interpret, to have appropriate proprioception, and that is where we are going to what's going to help us experience good balance. The next is foot and ankle mobility. If they don't move well, then we're going to get poor information coming in. If they can't make those adjustments, that's going to well, you're not going to be able to feel everything you could potentially or were designed to feel if you don't have that mobility in your feet and your knees. And I would also say probably everything up the chain as well, the knees, the hips, spine, everything. Another thing to look for is head forward posture. And I know I've talked about this before, and I cover it in the posture course, that there's science that shows that people with head forward posture and the kyphotic posture are more likely to have a fall. Movement issues such as head down walking. And the weird thing is that people will typically look down while they're walking because they don't trust their feet anymore. But then that ends up causing changes in the proprioceptive structures on the base of the skull, and then you've got your body weight is forward, and that head down walking it's a compensatory action, but it is not good for balance. Okay, strength in the lower body. We know that can be an issue. And, you know, back in the days when I was working as an OT in traditional settings, it was somebody had balance issue. The first line of defense was we're going to send them to physical therapy and get them stronger because they must just be weaker in their lower body. And then strengthen the core. So I was doing this, I do this frequently in my classes, like if we're doing band exercises and we're pulling the band forward or we're pulling the band back, then I ask them, feel as your core turns on as you reach forward, as you reach back, to keep your body stable as you're using your arms in a different way. So all those things could be contributors, and I'm going to run through exactly how I run through a balance assessment. If someone comes in and tells me they have balance issues, the things that I look at. But we have to also think about the fall may be not necessarily due to strength or a proprioceptive issue, but it may simply be an inability to catch oneself when you lose balance. And because we all trip once in a while. I mean, I like to think I have pretty good balance, but I've caught my toe on a piece of furniture and lost my balance. I've lived with pets my entire life until now, and I miss them. But pets who are sleeping in weird places, or I grew up with a little boy who loved to play Legos, and there was Legos everywhere, and you step on a Lego and that throws you off. But there's a lot of reasons that we can trip as a healthy, well-balanced person. But you might actually fall because you couldn't catch yourself. And that's a whole different ballgame. That includes the agility or the ability to move quickly. And then, can you put the brakes on? When you start to fall forward, Do you have enough eccentric strength in your legs to catch yourself? So that's a huge piece that I think we often miss when we're thinking about somebody who's falling. We immediately look to their balance, and their balance might be okay. Well, the other thing we look at too is the environment too. We ask about the pets. We ask about their throw rugs. We do all that stuff. Do they have, furniture that they can move around? Hopefully that's, if you're a bunch of OTs out there, hopefully that's an obvious thing. Okay, so what to do? What do I do? And what do I suggest maybe you include in your assessment? Because I'm going to just crab for a second here. There are programs out there, and I know they exist. Well, that's all I'll say. There are programs out there that I know, because I've had clients tell me about them, where they went somewhere and they were put in a harness that was attached to the ceiling, and they were asked to walk in a room that they then made it dark, and there was other visual distractions and lights, and I can see this client telling me the story right now in my head. And she said it was awful, and it was supposed to be challenging my balance, but all it did was give me all this anxiety, and I feel like my balance hasn't changed at all. And I'm just, if you are trying to challenge a system that is giving you bad information, you're still going to get a bad outcome. And maybe make things worse because you're giving people anxiety. Okay, so what to do? If balance issues are sudden, if they're severe, they're accompanied by other systems, then it's important to seek medical attention, especially if it comes on quickly, right? We know that. We just want to make sure that we say that, especially if the people from the public are listening, right? We want them to know, get help if it's a sudden onset, or if it's something that is continuing to get worse. Please go get medical attention and keep yourself safe until you start to get some answers. And when I say keep yourself safe, that means if you have to use an assistive device like a cane or even a walker for a little while, you might want to ask an OT or PT to help you set that up so you're using it correctly. But keep yourself safe. If you don't want to deal with that, then, and maybe if you notice you're tripping, I've had clients tell me, gosh, I feel like I just trip on cracks in the sidewalk or uneven cement, then take a hiking pole with you. That looks kind of cool. It doesn't look like a cane. It looks like you're just out for a little hike. Anyway, keep yourself safe. Keep yourself safe. So when those things are ruled out, and I get a client that comes to me who's otherwise pretty healthy, maybe there's other stuff going on, but we work around. As long as their medical issues are being addressed, and I know what's going on from that perspective, then here's how we move forward. So the first thing I want to know, and what OTs are so good at, and I'm going to tell a story that shows it, is asking about the history of falls. I want to know the details of when are you falling? What are the patterns? Is it more in the morning? Is it in the evening? And where do they occur? Is it in the kitchen? Is it in the bathroom, bedroom? Any patterns? Are you indoors? Are you outdoors? Are you tripping? Are you carrying items? Are you bumping into things? Do you have pets? What are the patterns? And this is a fantastic story that illustrates this. And of course, this is a true story. But this was in probably my 4th year of practice. I was working for a private practice in Northeast Iowa and doing a lot of outpatient home health. We had contracts everywhere with all different kinds of facilities. And I freaking loved that. I loved that job so much. But my husband wanted to move to Omaha. So anyway, we had a contract with a facility that had many different levels of care for seniors, at independent living, assisted living, and down the line. And there was a woman who lived in independent living who was having falls, and they kept referring physical therapy and asking, work on strength with her. She was a very tiny, fragile woman who used a walker. And it's so sweet, so lovely. And she was super compliant with therapy, but PT would come in, they would check over her walker, they would do a manual muscle test with her legs, and then they would give her exercises and she would do them, and then she would fall again. And finally my boss came to me and she said, Amy, here's what's going on. Would you please go take a look? And I did. I met with her in her little apartment, her independent living apartment. And I'm like, okay, tell me a little bit about, show me around your apartment, and then kind of tell me as we go around if you've fallen in that space, and is it morning, is it night? All the things I said earlier, trying to look for any kind of a pattern. And she walks me through the living room and the kitchen, no falls, get to the bathroom. I'm like, oh, this must be where the falls are. And she said, no, I've never fallen in the bathroom. And then we get to the bedroom and she's got lots of space to move around. She's like, most of the time I fall in here. Well, I guess pretty much every time I fall in here. And I'm like, okay, well, sort of walk me through. You get out of bed, you go to the bathroom, and then you might go to the kitchen, get a drink of water, come back in. She's like, well, let's see, if I get dressed, then I open my closet, and she opens this huge, like, double folding door style closet, and it is crammed with probably every outfit she's ever bought in the last 70 years. And I said, okay, well, just go ahead and pick something out, and maybe we'll just kind of run through your dressing routine and see if that is part of it. And so I'm standing behind her, and she's got her walker in front of her. She's being very safe, and she reaches up and she decides what outfit she wants to take out, and I'm kind of laughing because so many brightly colored polyester outfits. It was just so cute. But she reaches for one, and then she tries to pull it out of the closet. She reaches her other hand up to try and hold the outfits next to that one in, and then as she pulls it out, it kind of gets stuck. And as she starts pulling it out, she starts to fall backwards. And I kid you not, that if I had not been there, she would have fallen backwards and fallen down. So the moral of that story is it didn't have anything to do with her. It was completely her environment. And so we have to always dig deeper. And then also, well, not completely her environment, right? We talked about how ability to catch yourself. So maybe it was she couldn't turn her core on enough fast enough. She couldn't step back quickly enough. So maybe rather than training her on strength, they should have been training her on some agility and how to more quickly respond and react with her body because it was clearly strong enough. So I love telling that story. That's such a great story and completely 100% true. Okay, so the next thing I would do with somebody is I would want to know about their medical history. And if they have a long history of medical issues, traumas, medical incidences, then they probably have a lot of layers of fascial tension. And then, of course, I always ask them about their lifestyle and their exercise. Do they stretch? Do healthy eating? And if they don't have a lot of good lifestyle habits, that tension tends to stay in there. So increased fascial tension then means decreased proprioceptive abilities. So the next thing I'm going to look at is posture. And if they have a head forward posture, a tucked pelvis, flat spine, forward hips, turned knees, then that's going to be another indicator, especially when we combine it with past medical history, a lot of stuff going on, a lot of layers of tension, not great lifestyle habits. Then you can probably guess increased fascial tension and decreased proprioceptive abilities. The next thing I would want to look at is pain. If they're having pain in their body, then that is going to shift the accuracy of proprioceptive input. Pain often is a cycle of increased tension. Might have started with tension that made the pain hurt, so I'm going to hold my body, I'm going to have protective postures. Then we have to look at pain. And that's another thing that makes me think, well, and then change is probably going to change gait patterns and how they move and how they sit and how they sleep. So again, increased pain probably means poor, reduced proprioceptive input. So if all these areas indicate fascial tension, then that must be addressed in the plan of care. Fascia is our proprioceptive system, and it is I believe, the lowest hanging fruit that we can use, that we can pick to help improve balance. If we're not looking at that, you are not operating in a fascia-informed way that now we know that is a body system that we need to know about, we can access, we can capitalize on, and we can improve our outcomes through looking at the science of the fascial system. Okay, so if you are challenging the proprioceptive input but getting bad or limited information from the body system it comes from, you're not addressing it. Why aren't you addressing it? And the example I gave earlier of harnessing somebody up and challenging their balance, or tell them to go to a yoga class where they do all sorts of balance stuff, it's not going to help. The stretching of the yoga class very much might help, but if they're just doing balance activities and just go stand on one leg, go walk on different surfaces, it's garbage in, garbage out. Okay, so then what's next? If we know somebody has poor proprioceptive input or tight fascia and we're getting poor input, then what's next? So the next thing I would do would be check the mobility of the joints. Do they have the full intended range of motion that our joints are supposed to have in a otherwise healthy adult, especially in the feet and the ankles, and in particular the mobility of the fascia around the ankle joint. We know, if you've been following me at all on the podcast, or if you've taken the science class, you know that the retinacula across the front of the ankle is the most highly innervated fascial structure. And it is because the ankle and the feet are so important in our balance, our proprioception. So we need to make sure we've got full access of the joints in order to appropriately feel where they are in space, and all the full opportunity of range of motion that we should have access to. Okay, and I know some of you are thinking, well, not everybody has that, and everybody's a little bit different, and some people have had surgeries. Yes, I expect you to use your clinical reasoning when you think through stuff like this. Okay, then the next is functional strength. Functional strength in the lower body, but also the core. The core is massive in maintaining balance. Hopefully that's a duh, but I feel like I have to say it, especially because I don't think the public knows that. Next, I would want to check their eccentric strength. Can they easily and safely lower themselves to a chair? Can they easily and safely lower themselves to the floor? Or if they somewhere in between, we can, sorry, everything was timing out here for a second. Do they have the eccentric strength to do that? That's, I think, very important to know. And then I would also like to check, that's all, I'm sure I've talked about this in another podcast, but the ability then to get back up. I think that's another story. Lots of great stories there too. And then next, agility. Can they step quickly? Can you put them in one spot and then have them step out to the right quickly? And there's some interesting studies out there on quick stepping that I do include in the science class. So can they do that? Can they hop? Do they have that ability to hop? And we know that hopping helps to recreate that crimp in the fascia that actually it's like reversing our aging, because little toddlers they're very bouncy because they have that crimp in their fascia, and we lose that as we age, not because we're aging, but because we don't hop and bounce and jump and run and do all those things. Well, some of you do. I know some of you do. Okay, so the treatment is, number one, I'm going to help them reduce their pain. Because if they have pain, the chances of getting them to do all this other stuff is pretty slim. So helping someone reduce pain through and balance the tension in the fascia through hands-on treatment by a therapist who knows techniques, and self-treatment. I teach them how to do it on their own, so they're not just reliant on the once or twice a week or month they can come and see a therapist. And then working with them on improving their posture habits, because what we don't want is to treat their fascia and then have them go right back out and put all the tension back into it with poor posture or high stress and tension in their bodies. Then the next thing I'm going to do is help them improve their movement and greater access to their body through improving the range of motion in their joints. So improve joint mobility, and then improve strength of the lower body and the core. And then we might as well do the upper body while we're at it, because I think every motion is a full body motion. So we don't want to isolate taking tension out of the fascia, improving mobility or strengthening into any one part of the body unless it's very clear that that's an isolated problem. Improving eccentric strength, and then improving agility. And then let's go do some tree poses. Let's go. I keep the 2x4x8s in the clinic, and we might walk on a balance beam. And I might put those up on some yoga blocks if we need ready for a little bit more challenge. But then you challenge the balance skills, because then you're getting better proprioceptive input. So some of the information that I am sharing with you now is coming from this book. I'll hold it up for you. Okay, it's a big one. It's a heavy one. Fascia, the Tensional Network of the Human Body. This is actually the second edition. And the editors are Robert Schleip, who I talk about a lot, Carla Stecco, who I talk about a lot, Mark Driscoll, and Peter Huging. The Science and Clinical Applications in Manual and Movement Therapy. So this is chock full of a lot of dense information about fascia. And I'm just going to read you a couple things from this book. And this is also a very heavily, densely referenced book as well. Okay, so while the richness of intervention in the fascial net is certainly impressive, it could also be argued that fascia may also constitute our most important perceptual organ for perceiving our own body, whether it consists of pure proprioception, nociception, or the more visceral interoception. While in the past, much emphasis was placed on joint receptors being located in joint capsules and associated ligaments, current investigations indicate that more superficially placed mechanoreceptors, particularly in the transitional area between the fascia profunda, or the deep fascia, and the fascia superficialis, or the fascia that's pretty close to underneath the skin, should be endowed with seem to be endowed with an exceptionally rich density of proprioceptive nerve endings. It may be assumed without doubt that the connective tissue continuum of fascia and fascial tissue also serves as a body-wide mechanosensitive, and if you're not sure what this piece is, it's just the ability to feel pressure, twist, shear, the ability to feel movement and pressure in your body. Vibration. I'm going to start over. It may be assumed that without doubt that the connective tissue continuum of fascia and fascial tissue also serves as a body-wide mechanosensitive signaling system with an integrating function analogous to that of the nervous system, and therefore also plays a substantial role in the process of proprioception. And that statement is followed by 1, 2, 3, 4 different references. So now I'll take you into a couple other quick studies that I pulled up. And this is a 2025 study. The effects of plantar fascia stretching on ankle passive range of motion, balance, gait, and ankle stability in patients with chronic stroke. A randomized controlled study. Okay, so the objectives. The plantar fascia stretching intervention can correct balance ability and induce changes in spatiotemporal parameter of gait stability. Okay, the objective is comparing the effects of a 4-week program of plantar fascia stretching with those of calf stretching exercises on the ankle dorsiflexion passive range of motion and ankle dorsiflexion passive range of motion. Okay, so I'm going to skip down to their results. After 4 weeks of training, the plantar fascia stretching group showed significant improvements in all outcome measures compared to baseline. And the conclusion states, this study demonstrated that plantar fascia stretching exercise improved ankle dorsiflexion passive range of motion, open and closed eyes static balance ability, cadence, and foot and ankle disability index in chronic post-stroke condition. Now, if I was designing this or treating someone with this, I would do both. If I've got somebody with foot pain or foot issues, plantar fasciitis, I'm going for the calf and the foot in the treatment process. But there you go. Treating that improves somebody with chronic stroke. That's pretty amazing. And in our self-treatment workshops, we always do a bottom of the foot stretch to start with because it nets pretty amazing results in the whole body. We do a forward fold, we do a plantar fascial release, and then we do a forward fold again. And inevitably, everyone is like, whoa, how did we improve the stretch or the forward fold that much? Because in some people, it's several inches. Okay, the next study is a 2018 study. The effects of morphological and mechanical properties of plantar fascia and heel pad on balance performance in asymptomatic females. So they demonstrated that morphological and mechanical properties of plantar fasciitis and the heel fat pad play an important role in balance performance. The higher plantar fascia, the higher PF or plantar fasciitis and heel fat pad stiffness and thickness are related to higher postural sway in anterior, posterior, medial, lateral directions based on single balance leg tests. So when your fascia is stiffer, your balance is more poor. And that's what I was saying in the front end of this. Okay, the next one is a 2015 study, greater reduction of balance as a result of increased plantar fascia elasticity at ovulation. Okay, so I'll read this to you. There was also a significant increase in plantar fascia in thinning per kilogram weight applied to the foot at ovum compared to menstruation. Associated with this increase in elasticity at ovulation, there is a reduction in balance. So now here they're saying everything's too elastic, everything's too stretchy, because we've talked about in other podcasts that your fascia needs a certain level of stiffness in order to hold you upright and to hold everything together and to allow things to move properly within inside your body. But if it's too elastic, then that can cause problems as well. Plantar fascial elasticity change during the menstrual cycle might have effects on postural sway and tremor, which could have a potential risk of falling. Therefore, health professionals working with young female adults should recognize these effects. Okay, the next one is 2012. And this is pain, balance, activity, and participation in children with hypermobility syndrome. And their statement is balance and postural control also appear to be compromised, at least in children, when they have too much elasticity in their fascia. Okay. This was another long one. All right, so just to recap a little bit, what we know about balance is all still true, but we have a whole nother layer with fascia science to think about balance differently. And we can very easily integrate that into what we already know as therapists, as practitioners. And this is great information to share with your clients, because if they have pain, if they have layers of old tension in their fascia, they have poor posture, how are we going to improve balance? I think it would be quite a challenge. Anyway, it's low-hanging fruit. I hope you will take a look. I mean, you can either read this, a dense book. Let me see how many pages it is. Oh my gosh. Over 700. So, or take the science class. I boiled it down for you, the things that we need to know as therapists. And once you know those basics, when you want to dig deeper, you can dig deeper. I'm still digging deeper. Putting this, and to find a 2025 study, there's so much still coming out, and it's the science is there. We know about this body system. We know about the anatomy. We know what it does. But now we're starting to look a whole lot more at how can we use it. And if we don't know the basics about the anatomy, how do we know how to use it? The other thing that I'm hearing is from therapists out there is that more physicians are writing for myofascial pain syndrome, for tight fascia. What are you going to do? What are you going to do when you start getting those particular referrals on the patient prescriptions? Well, get the science down first, and then start thinking about how can you help them with posture? How can you help them with movement? How can you write your home exercise programs differently to address these things? I know there's a lot going on. There's a lot to address, but fascia is foundational, and we need to be looking at it. So as always, thank you so much for listening, and in some cases watching. Tried to put on a very nice, colorful shirt for you today. So I hope everyone has a wonderful, it's a really cold but sunny weekend here in Omaha, Nebraska. Thank you so much. Bye. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.